Good day. This is Amber Nero on KSLU's 90.9 FM. I am here today with wonderful, awesome North Oaks nurse practitioner Sean Deary, who is at the Independence Clinic. Yes?
Correct. Yes.
And he is sharing his point of view. So welcome, Sean.
Thank
so
you.
glad to
Thank
have
you guys for having me. We appreciate it.
Very good. Now, you are with the clinic in Independence.
Correct.
And this clinic is relatively new to North Oaks. In the last several years, it's
Correct.
kind of been established in Independence. You like it out there?
Love it. Absolutely love it. You know, the clinic, the patient population has been there for a number of years. They had a wonderful physician that was practicing that community for nearly 40 years. Toward the end of his career, he came on to North Oaks. We've had a few other physicians along the way that have kind of helped hold the torch. And now hopefully I'll be there for many, many years to come. But I love it. I live in the country. I live out in Folsom. Love the community. It's what I pictured when I had this in my mind on what I wanted to do. It was in this setting. So it's been a blessing thus far.
Right. And you're a local.
Yes, absolutely.
You are Southeastern grad as well. We were talking about that.
Times two. I actually went for my bachelor's in science. Got that in 2001 from Southeastern. I loved it so much. Went back to Southeastern and got my bachelor's of science in nursing from 2006, 2007. So loved it so much I went twice.
Right, and you're a Southeastern love story too,
That's
right?
That's right.
Tell me about that.
My wife and I met. My wife was a sociology major. We met here at the same time in 1998. Both of us continued until we got our degrees here, and we continue to come here to the university. Our kids come with us, and we go to Southeastern football games every season. We have season tickets, so it's we continue the romance with Southeastern all these years later.
Absolutely.
Definitely.
1998 was a good year. That's the year I met my husband too.
There you go.
So,
Must have been something in
absolutely,
the
and it worked out okay. So
Good.
very good. Now, we were also talking before the show that you can actually act as a primary care.
Sure, absolutely. So nurse practitioners, over 30 states in the country have given full practice autonomy to nurse practitioners, where we have the full ability to assess, identify problems, diagnose, treat, and reassess those problems in the future. So Louisiana is a state that does require us to have some independent supervision, where we can practice on our own, but we do have a collaborating physician that works alongside us if we have any questions or needs along the way. Legislation is always changing. Every year, a few states are moving in that direction to full autonomy. North Oaks, I keep referencing that, but I guess because I like it so much. That's it. I've been there for so long.
Yes.
Louisiana's moving in that direction. I think that we'll be there in the near future, but absolutely, even in the constraints we have with our current legislation, I can see patients ages 3 and up. I am the primary care provider and manage acute complaints as well as multiple chronic conditions such as diabetes, chronic kidney disease, hypertension, high cholesterol. You name it, we can see it. So
Right, and I think you were telling me that the confusion kind of lies in that the word nurse, right?
Sure, I think so. I think some of the cultural associations and the misconceptions with nurse practitioners is that I think that there's sometimes with licensed practical nurses, the LPNs, you have registered nurses, RNs, you have nurse practitioners, NPs. I think sometimes the confusion exists where there's not a full understanding of what the nurse practitioner can do. There's another complementary role in the advanced practice model, which is for physician assistants. A little bit of a different educational preparation for us to get to the same place, but I think with nurse practitioners, there is just the tendency to think perhaps it is more of a support role under the guidance of a physician. But no, in truth, we can do the whole 9 yards. We do everything. So
Wonderful.
It's great.
Which is why you're kind of here today to talk about immunization.
Sure,
yes.
sure, absolutely.
So tell me, obviously, you give immunizations
Sure.
at North Oaks Clinic in Independence, and one of the things that we always fear as parents is the day that you've got to go, right, to the doctor to get the immunizations. All right. They are obviously receiving proper immunizations so that as they travel through life, they're not picking up things that they shouldn't. Can you just kind of give me a broad overview of why it's so important for us to pay attention very early on and get these things done?
Absolutely. And as a parent, I dread it myself. I've got one child who she's a breeze when it comes to vaccines. It almost wears it as a badge of honor to not cry or be upset. I have my other child who doesn't like vaccines, and that's A-okay. But The reason vaccines are so important in vaccinations is that it is truly essential for community health. This is a fundamental population health practice that we pursue. The bacteria, the viruses, the illnesses that we immunize against with our vaccinations led to significant morbidity and mortality in the early 20th century and before that. Before the advent of vaccines, death during childhood was unfortunately a frequent part of life. These vaccines that we offer now help protect against these bacteria and these viruses that have significant health implications, and I think we lose that with the history and the track record of having such good vaccination protection. We lose fact that these are serious diseases, that these can significantly alter or end someone's life. So it is important that we hit those milestones along the way. When children come out, they do have some immunity that's passed through the mother. We see different variations of immunity, whether there's a vaginal versus cesarean delivery, whether a child is breastfed or formula fed. So some immunity is given through through childbirth and through early rearing, but we really rely on these vaccines to help protect against these serious illnesses.
And you're using some vocabulary here. And
sure.
We're kind of trading some vocabulary here, I think. What's the difference between vaccinations, immunizations, vaccines?
So it is
they're
almost
used interchangeable,
yeah,
right?
it is, and we do interchange them. A vaccine is the actual product. That's the product that we have developed that is being used to protect against a certain illness, be it a bacteria, be it a virus. A vaccination is the process of acquiring even me, because we say them so interchangeably.
Yeah.
Immunization is the process that a vaccine is able to give us that immunity for a certain illness. And a vaccination is, again, just kind of the method by us giving that vaccine to help protect against these illnesses.
Right. Now, obviously, there's been a lot of talk especially, I would say, in the past decade or so, with things like autism and things like. Tell me, are immunizations safe?
They are. And unfortunately, we never like to see the rise of any chronic health conditions, and
Sure.
The rise of autism is something that certainly is giving alarm to health providers to help us understand the links and the things that cause it. The immunizations, before they are provided and before they are disseminated to the public, have to go through rigorous, extensive testing to demonstrate their safety and efficacy. It is an imperative responsibility of the CDC to help make sure when we give these vaccines, they are proven to be safe. One content, one additive in vaccines, the thimerosal, is something that had some people concerned about a possible relationship, has been used as a preservative in vaccines since the 1930s and has been demonstrated over and over again to not show any increased risk for autism. So they are safe, and it's hard, and I empathize, I truly do, with a mother or father of a child with autism to say if that opinion is that the vaccines are responsible. These are hard conversations and hard things to try to navigate to figure out what it is that's causing this. But studies that have been done have really shown no link between vaccinations and the onset of autism. If anything, what has been seen, it's more of a temporal relationship. The majority of vaccines, especially at early age, are given about age 1. The onset of those speech delays that we see that help us ring that bell for autism is occurring about age 1. So it almost is, they're occurring at the same time. So then we look for associations, and I think that vaccines have been lumped into a causative factor when research and time has really shown that they're not.
Right. Now, we talked a little bit before the show about what's going on with measles.
Sure, yes.
Can you tell us a little, because we're getting it in short little stints.
Yes.
You know, we've got this outbreak over here, or is it an outbreak? Can you tell us about what's going on with that?
Absolutely. And at the onset, which is why I wanted to lead with this, as important as this is, vaccines only work if everyone gets them.
Right.
Because what happens is we rely on herd immunity, where everyone is getting vaccinations, everyone's getting protection against these illnesses.
Okay.
When we have segments of population for cultural, religious, personal, perceived medical beliefs that don't want to get this, unfortunately, these illnesses are not gone. These diseases are not gone. that we work to eradicate them through immunization where we decrease the available host that can hold and transmit it. But these things are still out there. So especially in parts of the world that don't have our immunization protection. So we consequently see when these small segments of population in different parts of the country, there's kind of different reasons. Some are more religious groups that just don't get vaccinated. Other are more for social reasons. We see that these illnesses are kind of popping up and causing these outbreaks, and it's simply because we have gaps in the protection. We've got a shield against these illnesses with holes in it, and where we see these outbreaks is where we've got those segments of people that have not been immunized.
All right, now that's one of the shots that you would get as very young.
Yes, correct. Yes,
so
they are.
What are some of those shots, just to kind of remind all of us who may not have little children at this point, what are some of those shots that you typically get in the early stages?
So early life, we're going to get a hepatitis B series. We're going to get, and with the number of the vaccines, the majority of vaccines have multiple vaccines that you're given. You're not given just one dose and that's it. But early in life, you have hepatitis B. You have Haemophilus, or HIV, the Hib vaccine, inactivated polio vaccine. You have MMR, varicella, hepatitis A and rotavirus or other vaccines you get. You also can get a meningococcal dose. It's a little bit later. But these early vaccines are essential because neonates and babies and infants, they are susceptible. Our immune systems are not fully developed at birth and early in life. That develops as we age and as we're exposed to things. So we need that early protection.
Now, we talk about the fear of bringing our babies, right?
Yeah, sure.
Because that is not a fun thing for adults. What are some of the things that we can expect as far as like side effects from those types of things?
So, and that's a great point to note, and we may discuss this later when we get to certain immunizations, but you are going to expect to have some side effects. When we are administering a vaccination, we are essentially giving the body a practice round. It's almost like training camp. We've got football season here right now. It's like a practice round. So we are mimicking to the body that something is bad. Our body then develops antibodies to protect against it. So we are training the body to be ready for that attack in the future when it's the real deal. So what happens when we have immunizations, it's not uncommon to have a little low-grade fever. With an infant, maybe a little fussy, a little irritable, maybe a little decreased appetite, potentially a little redness at the site. These things are all normal. I tell some of my elderly patients who are particularly afraid of the vaccinations because of the misnomers that, the flu will get you sick, the flu shot will give you the flu, the pneumonia shot will give you pneumonia. What it simply is doing, it is putting the body through an exercise to be ready for that illness when it occurs. Vaccines are either killed or weakened viruses. They cannot give you, or killed or weakened viruses or bacteria, they cannot give you the illness, but it's that simulation that develops our antibodies is what gives us the immunity. So it's important to know you may have fussiness, you may have a little low-grade fever, you may have just not really feeling great. Those things are going to last a day or two, 3 days at the most, and baby's going to bounce right back and things are going to be great.
Right. Now, oftentimes they have to get booster shots.
Yes, absolutely. So with vaccines, with vaccines, they are going to work, but just like we spoke about that antibody protection, as we age, as there's constant turnover in our body and our body's constantly refining the components that make us who we are, sometimes we begin to lose some of those antibodies. So we need to give those booster shots. Again, training camp. Drew Brees knows how to throw a football. He's been doing it for 20 years, but every year he gets out there and practices again.
Right.
Some vaccines we need to do it more frequently. Other ones we have much longer periods of time before we demonstrate that immunity begins to wane, thus giving us a booster shot.
All right, so take us a little bit through kind of the stages of different shots that children have to have, and going all the way up until adults. And you see children.
Yes,
too.
I see children ages 3 and up.
Right.
And one of the reasons I do that, truth be told, is because of the immunization schedule. It's the comfort and the familiarity that parents have, because this is such an important process. I made a decision to say, let me allow the parent to have that relationship with the pediatrician, get the majority of those early vaccines taken care of, and then as we get to age 4, 6 and move on beyond there, we'll kind of pick up with the vaccines. But there are vaccines that are given prior to discharge from the hospital. Some of the vaccines you're going to get before the baby even leaves. There are vaccines that are given at 0 months at birth. They're also given at ages 3 and 6 months. The hepatitis B, for instance, is one that has that series complete. In the first year of life, you're going to also have multiple doses of the inactivated polio, the Haemophilus influenza, the Hib vaccine, as well as the first dose of MMR, varicella, potentially rotavirus, and then hepatitis A. So the first year of life, there's a number of vaccines, and within some of those specific vaccines, there are multiple doses of that.
I'm impressed that you can remember all of that.
Well, and if anyone is a fan of the CDC and goes to the immunization schedule, if I forgot one, forgive me. We can rely, and we do rely on references that are static when they're available. So there's so much that changes. So having something that is there is a world of help to me. So
right, and we talked also that some of these things change.
They do.
Sometimes
Absolutely.
So
They can. The recommendations change. As new vaccines are coming out, they may make recommendations to do one over the other. So the CDC is a great resource that I do use. And truth be told, every single patient that comes through my clinic, regardless of how many times I've seen them, regardless of previous vaccines that I've given them, because they are such a big deal. With every single patient, I look at the patient's entire vaccination history. I look at the CDC immunization schedule, make sure we literally are checking boxes and make sure that nothing has changed if any recommendations have changed. So that first year, you're getting a lot. You're getting a number of doses. Some of those boosters extend into ages 15 to 18 months. And things kind of cool off for a little bit after that period of time, and then really pick back up the next time around at ages 4 to 6. Those are the bad ones. That's the big bad shots that nobody likes, because the children are a little bit older. They are a little bit more aware. They understand that shots don't feel good. So
and they tell you about it.
Yeah, absolutely. And you're getting more than one. It's not like you just get one and everything's all combined and everything's great. There are some vaccines that we do offer multiple protection against multiple illnesses with one shot, but unfortunately we have to give multiple shots. So personally, with both of mine, those were among our worst days as parents, my wife and I, when we had to do those shots. But they're necessary, and we get the shots at ages 4 to 6. That's where we're giving some more boosters. We're solidifying the vaccines and the immunizations we've already provided. And we get through that hurdle and things start getting a lot better. Ages 7 to 10 are generally going to be pretty quiet. If you've gotten everything you need up until that point, there's really not a lot to do.
Tetanus about that time. Yeah.
So tetanus is going to be right around that 11 to 12-year-old mark.
Yeah.
That's when we're going to get that booster, and that's when we're also thinking about meningococcal vaccine, also the introduction of the HPV vaccine, which is a newer vaccine. That is one that is among the vaccines. That's one of the newest ones on the market that protects against cervical cancer. So cervical cancer has been identified to be linked to human papillomavirus. So
we see the commercials.
That's right. The Gardasil is one of the main commercial providers of that vaccine. There are others, but the goal is if we can vaccinate early against HPV, then we can reduce the risk for cervical cancer, which is one of the leading causes of cancer death in females, unfortunately. So to have the availability to reduce the risk of one of the leading causes of cancers in females, it's great. I mean, that's the power what vaccinations can do. It does take some buy-in from the parents, and takes education from providers to help us guide patients and family members to make those decisions on what they think is best for them. But that's something that we offer at that age as well, that 11 to 12-year-old. As we continue to march through, at about age 16, you'd get that second meningococcal dose, the first one you get around age 11 or 12. That's one that you need for entrance to college. Some colleges are going to require it at different times, but we get that at age 16.
Dangerous.
Yes,
Very
absolutely.
dangerous.
Absolutely.
And we've had people in Louisiana that have unfortunately passed due to this disease. So
yes.
Very close to us.
Absolutely.
So,
it's I think that the push in the last 10 years especially has really increased awareness for meningococcal illness and meningitis, which is unfortunately
also
can be fatal. Can really be fatal, and it can really have a quick onset. First time students are away from mom and dad, some of the early symptoms we may not start thinking about fatigue, fever, kind of just feeling really achy, starts developing neck soreness, headaches, and then that can very quickly progress to decreased level of consciousness, confusion, coma, and unfortunately death in extreme cases. So it's great that we have that immunization, and the community push has been truly made. You're right. You see commercials on TV for a number of vaccines, because I think that because they work so well, we forget that they work so well.
Right.
So then we make the choice to not use them, and when that happens, we start to see some of these things pop up.
Kind of like the antibiotic situation. People stop taking them when they start feeling
That's
better.
it. Yeah, I'll save it for my next illness, and it generally it doesn't work. It doesn't work as well. No.
Not good. Now, we as adults are pretty bad about going back and getting booster shots for things.
Yes.
In 2016, when the floods were here and people were going to clean and take care of things, there was a big kind of local push to go ahead and get your tetanus shot if
Absolutely.
you hadn't done that in a little while.
Yes.
That's bad. I had to go do it because I knew it had been longer for me than 10 years. What are some of the things that adults need to pay attention to?
So not only
while we're
adults,
on that
and
list?
one thing I forgot, which is hugely important, not having the list directly in front of me, is the influenza vaccine. Starting at age 6 months, that is a huge need for protection against the flu, against influenza. But for adults, the main things we need to be worried about is if we have completed those vaccination series in early adulthood, we have demonstrated immunizations in immunity against those illnesses. The biggest things we're worried about are tetanus and diphtheria, which are recommended to be given booster shots every 10 years. As we age and go into our senior years, and as we are around more young children, that's commonly seen with grandparents, one of those tetanus boosters is actually recommended to be turned to what we call a Tdap, which has tetanus, diphtheria, and also acellular pertussis, which is whooping cough. So the tetanus, diphtheria vaccines are every 10 years.
I've seen a commercial on that too, I think.
You probably have.
Whooping cough.
You probably have.
I feel like I'm watching too much TV.
Either that or they're just marketing it very well to
Yeah.
you. It's that part of the brain that's just, maybe you knew we were talking about this, so that part of the brain was just focusing in.
So.
But the influenza vaccines every year, tetanus, diphtheria every 10 years. We get that pertussis as we get older in age. And then also the pneumococcal vaccines, the pneumonia shots, which you've seen commercials on that as well. The Prevnar 13 is the newer vaccine. Typically, those begin at age 65. There are certain health conditions, such as if you're a smoker, you should get the pneumonia vaccine earlier than age 65. If you have diabetes, if you have heart disease, if you have chronic kidney disease, there are a number of different chronic health conditions that do put you at increased risk for developing pneumonia. Thus, we vaccinate early. So it is truly important to have those routine follow-ups to help us hit those things and make sure that we're protecting, because an ounce of prevention beats a pound of cure every day of the week. And it's so much better to provide a pneumonia vaccine than to treat a complicated pneumonia that can unfortunately be fatal at times.
Right. Now, if I am a parent and I am sending my student off to college for the first time, and you do have to fill out the shot form and things like that, but some of these things are elective, right?
They are.
And we've got students on campus right now, so they who are just here for the first time, maybe a week or two in, but they're here for the first time. What should they have gotten, especially if they're living in dorms?
I think the meningococcal vaccine is important. I do think if you are an increase, you are a high risk patient.
What if I didn't have it at 11 or 12? Is it too late?
And it's an excellent question you bring up, because the CDC in their wisdom not only gave us guidelines to follow when we do everything exactly as we would expect, we also have catch-up schedules. So if someone comes in, if a mom, a dad comes in, baby or child is 8 years old and says, look, we've never given immunizations, we've had a change of heart, we're ready. We have immunization catch-up schedules that can really address every stage of early life, that can get us where we need to be. So it's not too late. It's never too late to get vaccinated. I do think the meningococcal would be important. And also, you think about those community, the vaccines that are really protect against those illnesses that are easily communicable. Influenza, again, is going to be something that's, as we're approaching this time of year, within the next few weeks, I've actually seen a few patients that I've clinically diagnosed with influenza with symptoms that are classic for the flu.
Already.
So it really.
Oh my word! So now's the time.
Now's the time. Vaccines are going to be, if they're not already available, they're going to be available with the local pharmacies here in the coming days and weeks, where we really buy. You get into September.
It's not too hot for the flu.
The flu never rests. The flu is always there. The prevalence for influenza is significantly skewed toward the winter months.
I am genuinely shocked that you're already giving people diagnosis of the flu.
Patients can be diagnosed with influenza and can acquire influenza year-round. It is something that we do more times than not seen in more of our susceptible populations, but it is around. It is there. It is always there. So within the next 4 weeks, 6 weeks at the most, I would be thinking about getting influenza vaccines, because it's something that otherwise, again, and it goes to where we say, oh, well, just get the flu and get over it, you'll be fine. Perhaps, certainly, the influenza is one of those optional vaccines. But as someone who's had a moderate to severe case of the flu, and they may tell you differently, that it's better just to get that shot.
No, it's not fun. And you know what else is not fun? Melanie Zafuto, who puts together this script for me every time so that I can follow and I can ask good questions, right? Thank God for her. But she always fusses at me and makes sure I get the flu shot. So it's better to go get the flu shot than to have that harassment from Melanie Zafuto.
If that's all it took, we would have Melanie be our PSA and have her be on commercials, and that would be it. But
she should do it.
That's it is. It's hugely important. It's very important to do.
Absolutely. And also, another thing that we haven't talked about yet is the shingles.
Yes, which is if there were one vaccine that I wish I could express the importance of getting in my elderly patient population, shingles is a vaccine that's universally recommended for individuals over age 50. It is a protection against the herpes zoster virus, which
50. Is that earlier than what it used to be?
Yes.
I want to say it was 60 before, wasn't it?
Previous iterations, it was 60. The newer recommendations are even as early as age 50, and most insurance companies do cover this. And what herpes zoster, when we are children, and now with the immunizations against varicella, it is changing somewhat on how shingles is going to present. But when we all had chickenpox as children, that virus just kind of lays dormant and is waiting for an opportunity of illness, of stress, of decreased sleep, sometimes no reason whatsoever. That virus activates, leads to a very, very painful skin rash, lesions on the skin. It happens in patches and patterns on one side of the body or the other. And it's not just something that you have and then you get over it and you're okay. You can have lifelong complications from shingles. There's a diagnosis that's called postherpetic neuralgia that can lead patients to have lifelong nerve pain.
My father got shingles several years ago, and he still has some. It's been several years, and I know it's been 10 years at least, and every once in a while it still kind of creeps back in, and he just has to kind of.
And what
it's typically with stress.
What I wish that I had was one of my patients that had previously had shingles to kind of be there and be my poster child for the shingles vaccine when a patient is deliberating it, because it is something that unless you know someone closely who's had it, you don't think about that. You're like, oh, I don't want that, I don't need that. But ask anyone who's ever had shingles, and like you can attest, it does. You see how uncomfortable it is. That is one of the most painful illnesses you can get, and it's preventable. So let's prevent it.
It's one of those, like, if you can think about it, I can remember when he was in the heavy outbreak of it, when he first got it, he would get up wherever we were and just go take a walk and be gone for a while he was waiting for the pain to subside. Because he was just so miserable. He was absolutely miserable. And get it in the summer. Good luck with that.
Oh, goodness. And the unfortunately, what happens with shingles specifically is, and we all try to limit our exposure to providers. Nobody wants to go and wants to schedule an appointment. So what we'll do, unfortunately, is we'll see something pop up. We'll kind of feel something, say something feels odd. You'll see a little rash pop up. You say, hey, that's not normal, but you keep waiting. And then by the time something clicks and says, "Oh my gosh, this is shingles," that may be 3 or 4 days.
I can tell you that my father is guilty of that.
Well, and this is the most upsetting thing for me as a provider, and that the reason I do what I do is I want to help people.
Right.
If you're 4 days into a shingles outbreak, the majority of the antiviral medicines that we prescribe to be effective really need to be prescribed within 48 to 72 hours of onset of symptoms. So if you're 96 to 120 hours into the illness, that medication that I would have given you on day one is not going to work nearly as well, thus increasing your risk of complications and that long-term nerve pain. So the great way we can prevent that is to vaccinate and to immunize. So it is truly a preventable illness that is uncomfortable, and just get the shingle shot. It's easy to do.
And that kind of leads me into something that I talk to a lot of North Oaks physicians and nurse practitioners and healthcare providers, and they all have one thing in common, and that is frustration if you give good medical advice and people don't take it, and then they return. So while we're ending the show, please, kind of reiterate that, how important it is to follow the doctor's or the nurse practitioners or the healthcare providers' advice when they're giving you that, and follow it all the way through.
Sure, and I say this and almost hope my wife won't be watching or listen later, because she will just use my own words against me. We all have that inclination to tough it out, or to not go, or to, as soon as we start feeling better, return to those activities. That's unfortunately human nature. But I will tell you this, is that we as healthcare providers, we've dedicated our lives to helping individuals seek, promote, maintain wellness. That's why we do what we do. When we identify problems and diagnose these problems that we see, we utilize clinical guidelines that have been backed and based off of years of research and demonstrated efficacy with medications, just observational data that we see as providers, that we know that these things work. We see this, these are the symptoms, this is the constellation of what you have, this is what it is, this is how we make it better. What happens is when we prescribe these guidelines, be it medications, be it lifestyle modifications, be it dietary changes, when we prescribe these, our goal is truly to help you. We want you to be well. What unfortunately can happen is when we fail to follow through or fail to pursue those recommendations, we unfortunately remain out of state of wellness. We remain with that illness. We don't get better, which can not only affect your quality of life, but can affect your health depending on what disease process we're talking about. So it is clinical guidelines and evidence-based practice and evidence-based medicine has really become the staple of what we do. There's very, very, very seldom, if ever, are you going to go somewhere and someone's just going to give you a recommendation because they just thought of it or pulled it out of their hat. This is all based on years of evidence and research that these treatments, these plans work for these problems. So failing to follow through on these things just simply lead to more prolonged illness. And I affectionately tell my patients, you drive the bus. I'm the GPS. Now, at the end of the day, you can turn whichever direction you want to, and I'll recalculate. I will. I'll say, if you won't do that, I'll change the plan and we'll figure out something to do, but I want to get you to your destination. Ultimately, it is our responsibility that we drive that bus. We're here to help. That's what we do. That's what we want to do. But it is very important. If that's the best thing, the one thing that someone can take away is if someone gives you a recommendation, truly think about that and understand that it's not just because we've got nothing better to do. We want you to be well, and that this is the way for that to occur. So I strongly recommend that.
Very good. Now, how can listeners get a little bit more information about North Oaks, getting their immunizations, getting their shots when they're supposed to do that?
Sure. So I'll have to review my reference here for some of the other reference. I know my way to get contacted.
Perfect. Let's give that one.
North Oaks Primary Care in Independence. We're on 230 Masonic Drive in Independence, right in town. Nice little clinic right by the train tracks, right in the center of town. Our telephone number is 985-878-4644. 4174. You can call us there, get an appointment scheduled. Be more than happy to come discuss immunizations or any problem you've got. I'm there.
Or primary care.
That's right. That's absolutely for primary care purposes. I'm there all day, is what I tell patients. Other ways that you can reach us, especially with our wellness drive and our wellness push, is www.northoaks.org/wellvisit. With regard to what we spoke about earlier with the CDC, which again I use personally in my practice and recommend all parents and even all patients to peruse and to see these schedules, is at the CDC, which is at www.cdc.gov. And lastly, the Louisiana Department of Health Immunization Program is www.ldh.la.gov.
Wow, you are a wealth of knowledge.
There we go.
Thank you so much. We appreciate having you today.
Absolutely.
I very much appreciate you as well as North Oaks for always coming back and sharing very current, very relevant topics with us so that we can take care of our health.
Appreciate you having us. Thank you. And anytime we have an opportunity, we're going to scream it from the rooftops. We're here for you. So
good. Let me help be a microphone for that.
That's right.
Okay? All right. And thank you for joining us here at KSLU on Point of View every Thursday and Friday at 11 o'clock. Join us again next time on 90.9 FM.